Welcome to the Maine Academy of Nutrition and Dietetics COVID Conversations video series. In this series, we will speak with dietitians around the state of Maine who practice in a variety of settings, focusing the conversation on how the COVID-19 pandemic has both positively and negatively impacted their work. Hey everyone, we are here today again with the Maine Academy of Nutrition and Dietetics for our COVID conversations. Today we are featuring two dietitians that work in community dietetics, and I will let them introduce themselves because they work in some pretty awesome programs around the state. Kate, do you want to start?
Sure. Thank you, Leslie. My name is Kate Yerksa. I'm a master's level registered dietitian, and I've been a dietitian since 2004. So before completing graduate school and a dietetic internship at the University of Maine, I worked for the WIC program for 4 years.
Nice. So you have quite a bit of background in community nutrition.
Yes.
What about you, Alex? Tell us a little bit about yourself.
Yeah, so I'm Alex Gaten. I'm also a master's level RD and licensed dietitian in Maine. I have been a dietitian for 2 years now. So before my current job, I worked as a Hannaford retail dietitian. I also worked at a hospital as a general clinical dietitian and also an outpatient oncology dietitian. So a lot of different experiences.
I was going to say, yeah, you've been dabbling in a lot of the fields of dietetics.
Yes.
So Kate, you're here today with us talking about the EFNEP program and how things have kind of changed over the last year. Can you give us a little bit of background about EFNEP and the population that it works with?
EFNEP is the Expanded Food and Nutrition Education Program. So a little background about EFNEP. EFNEP is actually the first federal nutrition education program that was developed for low-income audiences. EFNEP is a nutrition education program that is delivered by over 70 cooperative extension programs across the nation. And so University of Maine Cooperative Extension is the entity that delivers EFNEP in Maine because the University of Maine is the land grant institution here.
I get it now. So Alex, can you tell me a little bit more about maybe how COVID has impacted your work?
Yes, definitely. So in March 2020, UMaine EFNEP transitioned to remote education. And since March, we have provided extensive training to EFNEP staff on the use of technology and best practices to engage adults and youth participating in active learning through Zoom, which it seems like many of us have been switching to some types of virtual platforms. A cornerstone of EFNEP education focuses on planning, shopping for, and cooking healthy, inexpensive meals for the household. And without hands-on activities like learning knife skills or cooking techniques, which we would typically do in-person classes, I was able to create the Mainly Dish recipe video series that demonstrate how to make healthy, quick, inexpensive, and delicious foods, which really fits our audience. These videos have helped meet an identified program need and have been used by multiple programs in Cooperative Extension and other community programs. I have grown the video offerings to include 49 recipe videos and are shared through the EFNEP Facebook page and Instagram pages. I've also been able to manage the UMaine EFNEP Facebook page and has increased the page likes up to 505 people so far, which was up from 324 likes in January 2020. I also created a UMaine EFNEP Instagram page in March to reach a wider audience, as well as meet the needs of people during COVID-19.
I was just thinking that, like, we all kind of turned to social media during this time, mainly because we can't seem to find anything else to do. So it's really awesome that you can kind of have those metrics of increasing access to, important educational videos. So Kate, can you kind of talk about, you've transitioned to reaching your audience through social media, but is there any other kinds of ways that you have been able to reach your audience?
Yeah, it definitely has been a challenge to really develop very effective remote programming that is very relevant and accessible to our EFNEP audience. Another piece about EFNEP is that EFNEP program is designed to be delivered using a paraprofessional educational model. So identifying training opportunities for our staff really enabled them to be better educators. Additionally, we developed web-based promotional materials to really get the word out about our program. For example, we used QR codes on social media flyers that people would bring our potential program participants right to our webpage where they could register for a program using an online platform. Whereas we never had that before, that easily accessible opportunity to sign up for a class. We just didn't have that. Additionally, we have found that even though we have dramatically changed the platform in which we are delivering education that really focuses on more hands-on skills, when we evaluate our programs and compare our remote delivery of EFNEP to delivery of the program in person, the self-reported behavior changes that our adult participants are reporting are really very similar. And then sometimes they were better when they took those remote classes. So we're feeling like our effort put into really transitioning to a remote format over the past year has been beneficial to the audience that we serve. And that's really important because Cooperative Extension, our mission is really to bring research-based knowledge to the people of Maine. And we've really connected with a lot of new community partners that have helped us share information about the program and really encouraged maybe a similar audience to join an EFNEP class when they may not have had the opportunity before.
I think that's really awesome. I think we forget about how community programs also collect data and are able to show those kind of similarities, but also, like you said, you had a tick up in actually change in behavior, which in the dietetics field, we all want to see that change in behavior. So that's really awesome, and that's a success story that you can definitely share. That happened during COVID, a positive light. Alex or Kate, is there anything else that you want to talk about and tell our viewers about EFNEP or how COVID's impacted your work?
Yeah, I can take that one. So it's really been incredibly rewarding to be part of an effective EFNEP team to meet the unique needs of Maine's low-income families. And we've really learned a lot through this whole process. And really, when the pandemic started, many people were looking for resources, especially around food. So when stay-at-home orders increased the need, it really increased the need for ideas, for activities, for kids at home, information around food safety, and also the need for cooking support. So the pandemic really allowed UMaine Cooperative Extension professionals in the dietetics field to shine and provide safe, reliable nutrition information to the public through various articles, videos, webinars, and social media. So we had a really large role in trying to help the Maine families.
Thank you both so much for being here and sharing all this information about your program. And to our viewers, thank you for watching this another COVID Conversations with the Maine Academy of Nutrition and Dietetics. Thank you for watching this video. For more information on the Maine Academy of Nutrition and Dietetics, please visit our website or check us out on social media. For more information regarding the Maine Academy's public policy efforts, please feel free to reach out to our volunteers listed on the slide.